And I will take this opportunity now to introduce Dr. Monica Ponder, who is our community partner and community engagement lead for the project Advancing Health Equity in the City of East Point. I've been really enjoying the collaboration with you, Dr. Ponder, over the last, I don't know, couple of years now, and excited to hear this conversation with you and Mayor Ingram. So welcome.
Thank you so much, Megan. So it is my pleasure to welcome everyone here today and to lead this conversation with Mayor Ingram. I'm going to give a brief overview of her bio, and I hope that this conversation, you will find it absolutely engaging. Mayor Deanna Holliday Ingram is the 34th mayor of East Point. She's a champion, public servant, wife, mother, and advocate who is dedicated to public service. The mayor, her parents, reared her to think out of the box and lead change to improve the lives of others. She believes service is the rent we pay for our room here on earth. Mayor Ingram received a Bachelor's of Science degree from Florida A&M University in Business Administration, a Master of Science degree from Nova Southern University, and a JD from Howard University School of Law. In 2018 and 2019, Mayor Ingram was named as one of Atlanta's top 100 Black women of influence, and she serves as a board member of the National League of Cities, National Black Caucus of Local Elected Officials, Georgia Municipal Association, Airtropolis Atlanta Alliance, WellStar Atlanta Medical Center Regional Health Board, and the Clayton State University College of Arts and Sciences Advisory Board. It's my pleasure to welcome Mayor Ingram to this community conversation.
Well, thank you so much, Monica. I'm excited to be here today.
Yeah, I'm so excited about this conversation, and I just want to jump right into it. I know we don't have a lot of time, but can you, Ms. Douglas actually gave an overview statistics-wise about the community, but can you go into a little bit more detail and introduce us to your community, particularly the public health profile of the City of East Point?
Yes, so I am Mayor Deanna Holliday Ingram, Mayor of the great City of East Point, where there's no point like East Point. Our community is a multicultural, multi-generational, very diverse community. We have a significant LGBTQIA plus population within our community, as well as, we have housing diversity. And so we literally have housing in our city that anyone can afford, regardless of income level. So the full continuum of income levels, we have housing that's affordable. So we are committed to housing affordability as a part of our commitment to equity and inclusion. We are a city that is intentional about creating places and spaces for our community to gather and connect and create those very organic and authentic interactions and relationships with their neighbors. And also a place where we believe that everyone is valued, regardless of what you look like, where you come from, who you love, what your health conditions may be. Like, we're a place where we really believe that we are our brothers and sisters keepers. And so as it relates to a health profile, we have about 17.6%, so just under 18% of our residents who are uninsured. And we, of course, being a community that's predominantly a community of color, about 77% African-American, just under 10% Hispanic, and about 16% white. We have, of course, a number of people with hypertension, diabetes, those types of health issues that disproportionately impact communities of color, as well as a number of people in our community who need access to primary care. And so how do we ensure that we continue to work collaboratively to make sure that there's accessible, affordable, high quality, comprehensive healthcare within our community? And because I believe that, really healthcare services and healthcare is a fundamental right. Like, everyone in this world is entitled to be healthy, and when care is needed, receive the healthcare and the services they need to continue to be able to live and thrive. Because our health is our wealth, and being healthy is not a size, it's a lifestyle. So we create this culture and climate. We have the Healthy Point Initiative, which is a citywide initiative that helps seeks to increase the healthy lifestyle choices of our residents. And so it's year round, but we have a 90-day initiative where there's an intense challenge, and we offer free aerobics classes, total body workout, yoga, Zumba, box fit, boxing classes, Pilates. We provide cooking demonstrations. So to help people, understand how to cook food in a healthy way. Then we provide the ingredients and the recipes from the demonstration to those who participate. A part of our health profile and community in the Healthy Point is also healthy movie night. So a lot of times people just focus on what they eat, diet, and exercise, but a lot of it is mental. And how do we really start thinking about health in a way and realizing that health is accessible, it is attainable, and it can be fun. And so we watch Food Inc., Forks Over Knives, and What the Health is our last one. Run walks, but just really this culture and climate to ensure that we not only say that our health is important and that we believe healthcare is a fundamental right, but that we are creating a culture and climate for our community to connect and walk journey and be on this health journey together.
Thank you so much, Mayor. And I love the tagline, there is no point like East Point. So, and I'm glad that you actually made the transition easier for me. I wanted to ask you about the fact that the city of East Point was in the news recently due to Wellstar Atlanta Medical Center closing, South closing. Can you talk more about how this has impacted your community?
Yes, and so, if we look at the data, it would seem that this decision is in line with Wellstar's position that they are changing their healthcare model to provide the services that match the needs of the community. And what do I mean by that? So 99% of the people who show up at Wellstar, now East Point Health Center, there's an ER emergency room, there was an emergency room and hospital services. But 99% of the people who showed up in the emergency room. And of those, around 95% needed urgent care and not that level of acute care at the time. 5% did, so we definitely need to make sure that there are still life-saving strategies and services being provided at the location. But if we're talking about meeting the needs of the community that's actually using the health center, maybe this transition to this new model will help more match the needs that our residents are showing up with. And so the transition to 24/7 urgent care with primary care and diagnostic services, based upon their position and data, shows what the community needs. However, regardless of the model, I believe it is the choice principle applies, right? So I've met with Egbert Perry not too long ago, and he mentioned that we need housing affordability in communities where people with choice would choose to live. There's a power of choice. In order for healthcare to remain in our communities, we need Wellstar health systems to continue to choose to make the substantial and significant investments needed to ensure that there's high quality services and high quality care being provided, as well as market those services, invest in marketing to the actual community, not only in East Point, but in the South Fulton area. And then we need people with choice. So I mentioned there's about 18% that's uninsured. So that means about 82% of the residents in our city are insured. We need people with a choice, insured people, to choose to access their services, healthcare services at Wellstar East Point Health Center. And then we need doctors to choose to provide the healthcare services that our community needs at this location and to refer their patients to this location. I and my 84-year-old mother have chosen to receive services at the East Point campus. Our primary care is Wellstar, right? And so it is definitely, when I heard about it, I was, pleasantly surprised. I serve on the regional advisory board, but was not aware of the decision or involved in it, and became aware of it right before it became public. And I understand that's a business decision, right? Wellstar is a business that has the right to make that decision. However, if Wellstar is committed to continuing to provide healthcare services for our community, my goal is to ensure that we maintain healthcare. I think a lot of times when the business model of hospitalization is not working, and Wellstar is not surrendering or giving up its health certificate, its health license, the certificate of need. It will maintain that, and which leaves the potential of bringing back those types of services in the future if the people are choosing to use the services, or if that becomes a part of what the data, the community health needs assessments and the data is showing is needed. But it is shocking and concerning and all of those things when people hear that the only emergency room south of I-20 is no longer providing emergency care services, and that they're no longer providing hospital services, acute level of services. I understand those concerns. And I believe, again, though, if right now the model of hospitalization, acute care is not working, and the people who are using the facility are not showing up with that level of needs, overwhelmed, while 95% don't need that level of care, the goal is to demand healthcare, accessible, quality, high quality, affordable, comprehensive healthcare for our community, so that we keep healthcare in our community at different levels of ER and hospitalization. There are only two levels. Those are two levels of care, but they're not the only levels of care. Yeah. There are other levels of care, and a comprehensive model will include that as well. And I think I'm being optimistic and hoping that it is the beginning of the journey to have that comprehensive healthcare model.
Thank you so much, Mayor Ingram. You actually queue up my next question so easily for me. So you're actually making my job easy. You mentioned the Healthy Point Initiative as one of the ongoing activities within the health equity, I would say, umbrella. But can you talk more about the other initiatives your community has been leading? Of course, the project that with Morrow School of Medicine is central, but we're joining existing efforts. So if you could spend a few moments just updating us on the great work of your city.
Yes, so our journey to make equity and inclusion more than a cliche in our city started, yes, with a resolution and support from the National League of Cities, and participated in their initial Cities of Opportunity Health Equity pilot. And we created a resolution that basically, from a council perspective and as a government, we said that this is important and we're committed to infusing health equity and inclusion within all that we do, and created an ad hoc committee. And then as soon as we shortly after we did that, we realized this is a different way of thinking. This is not really the way that the systems and structures within this country have been set up. And so we need some experts. We needed some consultants, some people with expertise in this area to help us. And so we released a solicitation, and Partnership for Southern Equity was awarded the contract to work with the city to help us move this work forward. And that has been absolutely invaluable. The depth of knowledge of Partnership for Southern Equity and their chief equity officer and founder, Nathaniel Smith, has definitely helped us create a framework. And so prior to that, we also were selected by the Atlanta Regional Commission and Food Well Alliance to create the first city agriculture plan in the region, in the area, and I believe in the state, to really understand, we have a food insecurity challenge or food access issue within our community. Some call it a food desert. I call it glass half full. It's an opportunity to really create a local food ecosystem within our community. That opportunity came to us from residents. 2 residents shared that with council. We applied, were selected. And so now we have a city agriculture plan, which really seeks to create a local food ecosystem using the growers that are here. And we have Compost Now here. We have the Common Market here. We have, which is a food aggregator, right? We have a lot of assets. We have residents who are, really knowledgeable and experts within the food space or agriculture space. And so that plan provides a framework, and we have created a local food ecosystem commission that is working together to provide recommendations to us to further implement that plan. Then through working with Partnership for Southern Equity, there were a summer of equity where we had listening sessions at the park. This was around the beginning of COVID. I do need to back up and say that. So kind of started in January of 2020 with Partnership for Southern Equity, and then March, it was COVID and everything was transitioning, but we were still able to engage the community through, survey. We had the listening sessions, we had Big Idea Zoom sessions. We also there was a the East Point Leaders for Equity Academy, where residents from the 4 different wards within our city, wards A, B, and C, and D, were selected to participate and have this monthly dialogue and sessions and learning around what this work is, because we need more than the people, the mayor and council and the government to understand this. We also have to build a capacity of our community. And so through all of that work, we ended up with the Equitable Growth and Inclusion Strategic Plan being adopted by council. And it has 4 pillars. And the first, of course, is community engagement. How do we get our community more involved in the decision-making process and letting their voice be heard, being a part of what we're doing, being restorative, doing this work and moving forward with our community and not necessarily doing things to them or without them. And then the next is just industry. And so in July 15, 1912, the East Point City Council required all Black people in the city to live immediately adjacent to 3 fertilizer plants, an oil plant, and a chemical plant. It smelled so stink, they called it Stink Town. And so you can imagine the level of pollution and the environmental injustice rooted within that decision, and also within industrialization within our city. And so while that is the foundation and the rooted in racism, it unfortunately spread it to other areas of our city. And so we have other areas where residents in other industrial parks that are near residential areas, based upon decisions that were made before us that we've inherited. And now our residents are, really concerned and sharing their concerns about the impacts of those uses. So just industry is really about looking at how do we have adaptive reuse of environmental properties within our city or of industrial properties within our city. How do we really take them to a higher and better use that enhances the quality of life of our residents and doesn't negatively impact the quality of life?
Thank you so much, Mayor Ingram.
Starts at people experiencing homelessness.
Okay.
All the way through. And then the 4th is equitable economic development.
Okay. I think you may have cut out just a minute, but I do want to go back to the first pillar. So I'm going to definitely uplift the logo again. There's no point like East Point. And so I want to ask you about the community members. How have they responded to these health equity initiatives? What feedback have you provided, and what have you learned are some best practices when engaging the community around health equity work?
So, the feedback from our community has been varied. Our community is very candid. I do believe there is a overwhelming majority of sentiment that people are committed to looking at things from an equity perspective, like about how do we all grow and thrive together. And in the city agricultural plan, when we went through that process, we had very high turnouts at the community meetings and information sessions. And as we went through that process, because it was really a way to, have this multicultural, multi-generational conversation around something so critical within our city, right? Food security. As we move through the Equitable Growth and Inclusion Strategic Plan, through the surveys, through the listening sessions, through the East Point Leaders for Equity Academy, there were a number of different ways for people to engage at their comfort level. And I believe that residents enjoy that and now are really expecting it, right? And really expect us to continue to move in that way. In through the Healthy Point, we have over 200 people who have registered to participate and be a part of the 90-day health initiative that we continue to communicate with to build this community around health. And this not just that we say health is important, but actually we believe it's in our actions, and we incorporate that level of commitment to health equity and working to dismantle systemic inequities within the health system together. And I believe the overall sentiment has been one of increased engagement, increased awareness, and increased desire to really tackle these inequities together.
That is excellent. And I'm going to just say, as an expert in public health communication, I love how much you've explained the best practices and what you've observed. And I'm even curious if you can speak to this briefly about what association does the community make when they hear the word health equity? What does that term evoke in the community. So what, from a plain language standpoint, how have you communicated these efforts to them? Can you speak to more of the tactics when it comes to really the education aspect of health equity?
So I would say the first one, I don't want to listen necessarily in order, but so one tactic is giving our community an opportunity to be heard. So the survey that was very comprehensive, covered a number of different areas. So that was done during the health equity, during the partnership for Southern Equity engagement with the city. And we really recently also shared another community needs assessment. So having an opportunity for people to let us know what they need, what their interests are, and to hear from them. So I think a tool that does that. The other is being able to bring them in, right? To have conversations, to build education, to educate and build capacity around these terms. And so we did that through the Summer of Equity, through the listening sessions that were in person at the park. And we, had these poster boards and allowed people to just put up their thoughts, because people want to feel like they are being heard, and not just feel like it, people need to be heard. We also had big idea Zoom sessions. So one somewhere in person, somewhere online, again, to give people the flexibility to interact and engage where they felt comfortable. Sharing information through our social media and through our website and through all of our different communication platforms to continue to push out the information to the community, as well as a way to connect with us. And then ultimately at the East Point Leaders for Equity. So that was a more intense, so we were talking about progression or level of engagement or level of really engaging the community around this work. Through that, there were monthly courses, I believe it was over 6 to 8 months of learning about key terms, what is health equity, what is equity, right? What is community benefits? We hear all of these terms, what does it mean? And how does that look within our community? And so, really giving a way for them to share with you what they need, showing up, being in person and communicating and hearing, and giving an opportunity for people to participate that way. I think moving forward, we will never get away from Zoom and these virtual spaces. And I do think there's definitely a place for it. So maximizing those opportunities, and then creating a cohort, creating and investing within building the capacity, and from a very intentional level with our residents or with the people you're working with, to really start building that knowledge base, that capacity, because change is only sustainable if the people demand it. If the people understand it and the people demand it, it doesn't really matter who's in the seat or what's happening. We want to create a culture and climate within this city where this is permanent, this is long-term, this is, generation will impact generations to come because of the systems that we're building in this city.
Thank you so much, Mayor Ingram. So when paving the road to health equity, we must recognize the role of policy in improving community health. So can you speak, I know we're nearing the end of our session, but can you speak a bit about how you engage local, state, regional policy leaders in your health equity agenda? And then what have you learned as best practices to actually do this work?
So I think when we look at health equity, so this was the work, and we are extremely grateful for Morehouse focusing on the community of East Point to advance health equity in our city. That has helped create a springboard, or a platform, a foundation to really dive more deeper into this work. I believe the Wellstar decision and situation really created an ample space to continue those conversations. The conversations at this county, state, and federal level started years ago when I first got on the regional advisory board and kind of understood, the lay of the land as it relates to AMC South, which is in East Point, and AMC Main, Atlanta Medical Center, I'm sorry, using acronyms, the Wellstar hospitals. And my question is, what's the plan, right? We can't continue to operate in this way. And knowing that the county, Fulton County, provides over $40 million annually to Grady Health System to provide services for indigent care, people who provide indigent care. How is there opportunity there, right? So that was the initial conversation with, trying to engage the commission around looking at could there be some level of support. We then brought to the table, county commissioners, state representatives, had conversations with our federal delegation as well to talk about, and even when the announcement was made, like literally within 24 hours, I've communicated with the people on all of those levels, because collaboratively, we understand the importance of healthcare, and that healthcare is a fundamental right, and that it takes all of us working together. And so really it's reaching out, knowing who your representatives are, having a relationship with them prior to a situation happening. And then as and working on initiatives together, and really, making yourself available to understand and be ready for opportunities as they come along, because there's so much with the bipartisan infrastructure law and all of the funding that's coming from the federal government, the American Rescue Plan Act funds, the CARES Act funds. There's so much money now coming into communities, but the real challenge and the real opportunity is to make sure that those funds are used that will actually disrupt these systems of inequities and provide, support, relief, and change and transformation long term. And we might not see this level of using of these types of dollars within our communities, anytime again. But right now, we have this opportunity, and it continues to take that level of coordination. So we are constantly in communication with our representatives at all levels, and they have all been there for us, and we will continue to be good stewards and be there, for those opportunities as well, and ways that we can support. But this is bigger than us, and we have to work on this together, right? We can't look at it like, well, it's not me. I have insurance. I can get where I need to. It's not really about that, right? It is really about our community and being, our brothers and sisters keepers, and advocating when you're in spaces and places and at tables. And I feel like really I'm there to advocate for people who aren't, right? For people who don't have that voice, and to make, I'm always conscious of not being political. I know that sounds a little kind of oxymoronish as an elected official. I say I'm a public servant, but I don't politicize people's issues, right? And so believing that healthcare is a fundamental right means that in a situation that seems, very bleak around 2 levels of care no longer being provided at a community, it is being committed to ensuring that healthcare is there, and what that model looks like, and looking at the needs of our community and continuing to make sure we have healthcare services there. I think so often across this country, communities that are experiencing this challenge, it's not just East Point, it happens other places where hospitals decide to literally close. Like Wellstar is still open, it's operating 24/7, it did not leave, but there are places where they turn the lights out. And demanding hospital a model that is not working ends up with an empty building, and there's no healthcare in that building, right? The conversation around, well, there are different levels of care, that's 2 types. Can we have other levels of care in this community? And driven by what our community needs, and fighting for that. So I know I talked for a long time around that, but the level of collaboration at all levels and with all partners, right, is critically important.
Well, we're here in a community dialogue for a reason. So thank you so much for just sharing all of your insights. And I do want to just give you an opportunity, if there's anything else you want to share with those who are maybe tuning in or may actually see the stream at some point. Is there anything else you'd like to share about implementing health equity on a local level, making sure people understand that social progress takes time? But if any last words you'd like to share with us, Mayor Ingram?
When we talk about health equity means that everyone gets what they need, not what we think they need or what we think they deserve, but you create a system that meets the needs of everyone. Not that your needs are taken care of and you're good, right? That health equity means ensuring that there's accessible, affordable, high quality, comprehensive health care within every community across this country. And so that requires, again, not being political, not being sensational, really dealing with issues and holding people accountable. Like, there's no pass to Wellstar or anyone who's in that building about the commitment and the demand for healthcare from this community, right? There's no pass on that. but there also has to be a level of being realistic, having real conversations about what the real issues are, and dealing with those issues and not the issues that people want us to believe because they're the most sensational, they sound the most dire, right? The glass half full perspective of the health WellStar situation is that 95% of the people that showed up didn't need acute care, right? They didn't need a level of acute care, meaning they were not experiencing any trauma or any really intense healthcare needs, acute healthcare needs. That's a good thing, but they needed healthcare, right? So how do we ensure when we're fighting for health equity that, and it takes time, it might not be the most popular point, it might not be the most politicized point, but these are people's lives. And I think we have a commitment, and as a being honored that the people of East Point allow me to serve them, I'm not gonna politicize real issues. And I think that's critically important as we move forward to ensure and advance health equity. We need to look at the data, we need to have conversations, we need to meet people where they are, right? People aren't, we did a community needs assessment and we got almost 400 people, but there's 38,000, a little over 38,000 people in the city of East Point. We need to be continuing to engage our community and being where they are and making ourselves available to get that information. So it is, you don't get out of it overnight because we didn't get into it overnight.
Well, thank you so much.
Yes.
Thank you so much, Mayor Ingram. This has been a phenomenal conversation. I will continue to be a champion for the city of East Point. And if everyone can say it with me, there's no point like East Point. We really appreciate you taking from your busy schedule to speak with us and share about this project.
Thank you so much for the opportunity.
All right.
Bye-bye.